I'd like to start by presenting this session on EM thesis and easy steps. I'd like to say work smart, not hard, but I'll come to that at the end. I'd like to thank a Society for Emergency Medicine India National Board for giving me this opportunity to be a part of their April 2025 session to take this e-lecture series. I bring you greetings from Manipal Hospital, Old Airport Road, Bangalore. So I'd start off with a quote saying if you didn't invent or create it and you weren't born knowing it, then you must reference it. This was stated by Faye Hicks, an author, and it is quite apt to making a research study. So the steps involved would be to choose a topic and formulate and submit the research protocol, which is called the abstract, which also contains a literature review. Once the abstract or the research protocol is ready, approvals have to be got, which is from the scientific and the ethical committee. Then starts the process of the data collection, analysis, and interpretation involving statistics, and then you look at the results, discuss the results, conclude, and summarize your study. Seems quite easy. Let's go step by step. I would also say that you should consider good clinical practice guidelines and the BCBR research methodology, which is an online free course. I'll be talking about it towards the end of my presentation. It's very, very important to start off doing a thesis, thinking of it as having publication potential, because that's where your paper is going to land on an international platform. And a thesis should always be a stimulus for future research. It should not be the dead end of research. So we begin by choosing the topic and submitting a research protocol. So the topic selection involves conceptualizing. Doing a course in emergency medicine requires choosing a topic which is relevant to the specialty of emergency medicine, and it should be feasible. You should have adequate resources, you should have funds, you should get participants, and you should get these participants in the specified time frame which is required for your study. For example, it would be very inappropriate if somebody decides to do a study on COVID-19 now on a prospective basis, because you will clearly not get the participants for the same. Nobility is another thing which is quite nice to know and conceptualize, but it's little difficult to try to do a study for the first time which is not researched already. But it should be kept in mind when you are coming around a thesis topic. You'd want to do something slightly different from something which is not researched already. And importantly, your study has to be ethical. It should not cause any harm to you, your institute, or your participants. Next step would be to read and discuss. So you have to narrow down the topic. Now in emergency medicine, you can choose whether you like it to be a clinical topic, something to do with approaches, something to do with the management part of it. Would you like to do something regarding diagnostics in emergency medicine, pre-hospital care? Or would you like to do on a particular condition like say stroke or MI or heart failure or trauma, diagnostics like POCUS, ultrasound, or would you like to do any point of care test, or would you like to do anything with radiography? So you decide what is the topic you'd like to do on and read articles about the same. Also, you can look up online database and discuss with your peers and seniors. So if you like to know which articles to discuss about, so if you Google emergency medicine journals, you get a huge list and it becomes quite exhaustive. So it'll be difficult for you to actually research looking at journals. So this is where your databases come into the picture. There are 7 best databases for research, but the most widely used would be PubMed or Scopus. Science Direct by Elsevier is also widely used, but it requires some form of payment to access it. So if you have an institutional access, you can click on the search button. This is what will come. So this will show me 275 results, as you can see. So it becomes very difficult for you to go through all this. So here's where your filters come in. So on the left side, on the left side of the screen, you will see the filters. So you can choose the last 5 years and choose free full text and prefer to look at clinical trials or meta-analysis or systematic reviews. And based on what you get, you can use that as a base to decide on your title of the topic. So when you're formulating the topic title, you'd like to answer 5 basic questions. What are you studying about? That is your topic of interest. Whom are you studying on? What is your population of study, or who are your patients? Where do you want to study? Which place, or are you looking at a particular religion or a country? How long do you propose to study, and what is the design or the type of study you're going to do? So let's go back to the topic which we searched on PubMed, HFNC in the ED. So for this topic, if I have to look at what are the factors which influence this topic, I'd look at patient factors, looking at the cost, looking at how accepted they are towards using HFNC and what would be the compliance rate. And second, I'd look at ER physician factors. Are they really aware of the use of HFNC in ED? What is their attitude towards it? How easily would they use it? And what is their practice? There's no point doing a study on HFNC in the ED if you're not practicing it in your ED. Also, you'd like to monitor the patient and look at the effectiveness of your monitoring. So if these factors are something you could consider looking at as a title of your thesis or something you could research about. You should also look at system factors. Is it available in your hospital? Is it also available in your department? You initiate HFNC in the ED, it has to be continued in the ward or the ICU where you're shifting the patient. You cannot do a study on a topic where you are initiating in the ED and there is no continuum of care, especially when you're choosing something like HFNC. So when I look at all these topics, I can do so much with HFNC in the ED, but I'd like to keep it clinical and I'd like to look at effectiveness, focusing on the physician factors. So then I'd like to answer the 5 questions which I asked you earlier. So what is the topic? So I'd like to look at effectiveness of high flow nasal cannula. On whom? On acute hypoxemic respiratory failure patients. Where? In the ED of probably XYZ hospital in Bangalore city. When? Over a period of 1 year. And how am I going to do the study? I'm going to make it a prospective observational study. So when I look at the topic again, it will be a prospective observational study to assess the effectiveness of high flow nasal cannula in acute hypoxemic respiratory failure patients in the ED of XYZ Hospital Bangalore over a period of 1 year. So when you're formatting the title, it is important that you answer the 5 questions which I told you earlier. Capitalize each word of the title. If you can see the title which I have shown here at the bottom of the screen, each word of the title is capitalized. And I haven't used any abbreviations. I could have written high flow nasal cannula as HFNC, but you cannot do that. When you are presenting a title, you cannot use abbreviations and each word should be capitalized. Now we have the title ready. Now let's look at the protocol. Let's create the protocol or the abstract to submit it. So for the protocol, I need the title, I need an introduction, I need to define the problem statement, I need to look at the objectives, have a research question, do a review of literature, and also look at the methodology and cite references. So the title of the study we've already found out. Let's look at introduction. Introduction is a meaningful presentation of the study. I'd like to give a background of the study. I'd like to say that why I'm trying to do this study, what is the relevance of the study, and it has to be brief, clear, and concise. You have to explain what the topic is, why have you chosen the topic, and why is it important to do the topic. The problem statement is the scientific justification of the study. It is the basis of the need for future research to generate knowledge that will contribute to the existing knowledge. So a convincing argument has to be made, saying that there is insufficient knowledge available for the problem, or you want to test a question of fact because you are finding new findings in your area. And the investigator should have performed an exhaustive review of literature before proposing the problem statement. The research question is usually presented in PICO format, where P is the population of patient and the problem. I is the intervention or exposure. Basically, what are you going to do with the patients and what are they exposed to? C is the comparison. What are you comparing the intervention with? And O is the outcome. What happens when you compare and what is the outcome you are getting? So the objective should be clearly stated. Suppose you're having multiple objectives. You can divide them into primary and secondary objectives. Secondary objectives are usually length of stay, mortality, etc., or other complications which can occur. But the primary objective should focus on your research question. If you have multiple primary objectives, each objective should delineate only one issue. And each objective should have an action-oriented word, like you'd like to determine something, correlate something, compare something, or to ascertain, or to find out. Objective should be SMART. What do I mean by SMART? Each objective should be specific. You're going to state what you're doing and you're using action words for each objective. It should be measurable. If I am measuring a parameter, if I am, say, measuring, coming back to my title which I gave as an example, as HFNC in the ED, what can I measure in that? I can measure saturation. I can measure ABG values. I can measure outcomes in terms of oxygen capacity required by the patient. So that it should be a measure, and you can use metrics or data targets. It should be achievable. You should be able to do it in your scope, and it should be relevant. It should make sense. It should be relevant to the emergency department and time bound. You should be able to do it in the time allotted or time specified. Literature review is an extensive review of literature done by the investigator. Why do we need literature review? You're going to prevent duplication of the work done before. If it's already done by somebody in your department, there's no point doing it unless it's been a significant time or there's something new added to it. And the literature review gives a good insight into the methodology used, outcomes, and the need for the study. So when you look into other studies or similar studies done, you can get some idea on what your methodology is going to be used, what kind of methodology you're going to use, and what are the outcomes you can expect. And each supporting article should be briefly presented with the year of publication and the hierarchy. So it identifies gaps, establishes context, and also it supports your hypothesis. There are 3 types of literature review organization methods. You can either have a thematic literature review where you can divide the literature review into subgroups and you can present it based on the groups which you've made. Or you can present it in chronological order, that is in hierarchy. You present the oldest literature which you think is suitable to your thesis first, and then sequentially on a year-wise basis, in different paragraphs, you have the subsequent literatures. Or you can do it methodologically. That is based on the method designs which are used. You can group all literatures or articles which have similar methods of the study, and you can group them together and give their findings together. Then we come to the methodology. So here we are going to say the design. What kind of study is it going to be? Is it prospective, that is you're going to do it from today onwards, or retrospective, you're going to collect the data of something which has already been done? Is it observational study? You're just collecting the data of things which have happened, or you're analyzing something, or you're introducing some intervention, or you're comparing. What is your design? What is the site? Where exactly are you going to do it? I cannot say I'm doing a study in Manipal Hospital, Bangalore. I'll have to specify where in Manipal am I doing it. So I will say Adult Emergency Department of Manipal Hospital, Bangalore, which is a quaternary care center. Duration of study. How long do you plan to do the study? So many months or so many years? Who are the participants of the study? Acute hypoxemic respiratory failure are the patients whom I'd like to include. Whom would I like to exclude in the study? Probably patients who are intubated outside, patients who are not willing for HFNC, patients, obviously the intubated don't arise. So patients who are not willing for HFNC participation, or patients who are not compliant, and patients who don't wear the HFNC for a long period of time and are moved to NIV, probably exclude all of them. data collection plans. How do you propose to collect your data? How are you going to know? So what I would do is, if I'm doing a study on HFNC and I wouldn't want to miss out any case, I would ask my nurse to give me a list of patients for whom HFNC mask has been billed to, and that will give me my data. And I would probably tell all the doctors to give me whatever metrics is required for the study as and when they see and treat HFNC patients, and also probably keep a book in the department and ask them to write the patient's name and hospital number so that I can follow up on the patients. So that would be a 3 ways so that I don't miss out on any case. What is the proposed statistical analysis? How am I going to analyze the study? And what will be my sample size? A sample size, there are many ways to calculate sample size, and it's usually based on how many patients you see fitting that topic in your department. So based on that, the sample size is calculated. And I'd also like to describe the process. How am I going to do the studies? All adult patients presenting with acute hypoxemic respiratory failure will be seen in the adult emergency department of XYZ hospital, and the ER physician manages the patient accordingly. What is the process of management? How am I going to, HFNC decision will be taken. Once HFNC decision is taken and HFNC is initiated, the study will be explained to the patient/attender, informed consent will be taken, and the patient will be enrolled for the study. The patient will be subsequently managed by the ER physician, and data will be collected in the proforma after the patient has been shifted out from the department. The patient will be further followed up by the investigator, and outcomes will be analyzed. That would be the description of the process. And then we have to cite references. So there are 2 ways of referencing, either Harvard style or Vancouver style. Vancouver style is usually preferred, it's easier. The Harvard style, this is the format for Harvard citation. The author's name is written first, author 1, author 2, author 3. What is the year of publication? What is the title of the document? And then other details like who's the publisher, how do you access this document, and how many times it's been accessed. The Vancouver referencing style, in contrast, starts with the author's surnames or initials, and then you have the title, as opposed to the Harvard style. And then you have an abbreviated journal name, and towards the end you have your publication details and where exactly you can access it. So the study proforma contains the data to be collected: name, age, gender, hospital number, what was the saturation, what was the provisional diagnosis, what time HFNC was started, consent taken at what time, what were the parameters you document, what was the ABG values. So it is the data which you need to do your analysis. You should be specific, you should focus on the objectives, you should give options wherever possible. Like if I'm looking at outcome, I'd prefer to write admission, discharge, or death so that the person who's filling the proforma can circle one of them, and it makes it easier for me. The next important thing to attach with your abstract is a patient information consent form. It's very important at the beginning of it to write what language are you taking the consent in. So either you can have the consent printed in multiple languages, or you can write language and leave it open and write the language and have somebody who knows the language discuss it with them. It should contain the investigator's details. Who am I? What is my designation? What is my placement in this hospital? And how will I be available? My phone number, my email address, the topic details, the thesis. Then what is required? What data is required from the patient? Do I need only... you have to explain to the patient that it's not going to affect the management of the patient, and only once HFNC is started, we're just collecting whatever tests are being done to monitor the patient, we're collecting the values of that. Again, if it's an interventional study, you have to clearly mention the risks involved, you should mention the liability, and everything should be presented in detail in the consent form. The risk involved can also be monitoring if the patient is going to bear additional expense at the cost of your thesis. It should be clearly explained. Signatures should be that of the patient or the legal guardian of the patient. Also your signature as a researcher or whoever's collecting the data on your behalf, and also a witness who's a third party to your investigative consent process. Along with the protocol, you have to attach details of the personnel who are a part of the study, that is your co-investigator, their qualification, designations and research experience, your guide or supervisor's details, what is the proposed budget of the study, conflicts of interest and disclosures, ethical committee or scientific committee approvals, study pro forma, and the patient information consent form. So once you have all these ready as a part of your protocol, you submit it to the scientific and ethical committee for their approvals. So you submit it with a covering letter, and you're usually asked to present it at the research committee meeting. Once you present it at the committee meeting, the committee members will review your proposal, and if they have any comments or modifications, they will inform you of the same. You are then advised to make changes as per the committee requires and submit the reviewed proposal. The scientific committee members will review the proposal again, and the reviewed proposal will be forwarded to the ethical committee. The ethical committee will again go through the same process, and once they are convinced, you will get a draft which is both the approval from the scientific committee and the ethical committee. Once you have the approvals, you can proceed with your thesis. So we've chosen a topic, we've submitted the protocol, we've done the literature review, and we've gotten the approvals. So now we'll start with data collection, analysis, interpretation, which also involves your statistical analysis. So in data collection, it is very, very important that you inform your peers, that is your other doctors, your seniors, your nurses. Probably make flyers of your thesis and put it up so that people are aware that when such patients come which fit into your study, they should inform you. You can collect the data from multiple sources, and it's very important not to miss a single case. And you can collect the data by either questionnaires, or you can collect it retrospectively from the hospital information system, or you can do it on a live basis using Google Forms or Excel sheets. So the analysis is usually done using Microsoft Excel, and it's very, very important to subgroup the data and not have many variables. For example, let's start with a simple thing as age. If I have to collect the data for HFNC outcomes, and I look at the age of the data collected. Suppose I say I collect for 50 patients from the age of 18 to 65 years. I will get, you can imagine the number of variables I get. But when I analyze, I'll have to subgroup it. So I'll probably group it as 18 to 30, 30 to 45, 45 to 65, the range. I'll make multiple ranges and subgroup the data. And based on that, you can go for statistical analysis. So the variables should be minimal. You can subgroup as however you want. And the best way to subgroup is after you have collected your data. Never subgroup before the data is collected. And once you have your data, we move to statistics. So in biostatistics, descriptive and inferential statistics, inferential analysis is what is preferably used. So when we look at descriptive and inferential statistics, suppose you look at a population and you take a sample of the population, which is your case sample size, and you talk about the sample as it is. You analyze, you collect data from them as per your treatment, and you describe the data which you've got. That is descriptive statistics. But from this sample, you make some analysis, you make some conclusion, which you think you can generalize to the whole population. That becomes your inferential statistics. So there are a lot of parameters which can be used in each. In descriptive, you can have measure of central tendency, variability, and graphical representation methods. In inferential, we have probability distribution, hypothesis testing, regression analysis, and confidence intervals. So biostatistics is a different lecture on its own, and it can definitely not be taken in 1 hour. But this is a base for all of you to look at. There are a lot of tools available to help you in data analysis. The most commonly used are Webmaster and Google Analytics, which will help you make your presentations. So we've gotten the research, collected the data. And we've done the analysis using statistics. Next is to proceed with the results and discussion. So how are you going to present your data? The data is always presented in the research results section, and the objective of your research should be kept in mind. Don't get carried away by the data. Focus on the objective. Also, results which are not part of the objective should not be presented. So when you are collecting data, there are a lot of things which will divert you. Or you can say, I can also do this, I can also do that, I can also collect this, I can do a subgroup analysis. So don't get carried away. Focus on what you want to do. Focus on what is required, what is your objective, what you started with, and go in the same line. Don't get diverted. Also, statistics should not take over the paper. And you should present the results in a data in a logical sequence. So how will you present the results? So suppose I cite this article from the American Journal of Emergency Medicine, which is high flow nasal cannula for adult acute hypoxemic respiratory failure in the ED settings. So they have started off their results by presenting a flow chart. In the flow chart, they're telling us how many patients they recruited, then how many they excluded, and what were the variables for each arm. And then they have presented in the form of a table where they have analyzed the HFNC with a control group. So every table should have a heading, it should have a title and a numbering. So from the beginning of your thesis till the end of the thesis, the numberings go for the tables. Similarly, the numberings go for the figures. So every table should have a numbering, and it should have a title, it should have a header, and then it should have all these parameters neatly stated. If you are giving any p-value, or if you're giving any other data, any interpretation, any analysis which you have done, you should put an asterisk and mention about it below. Anything you want to summarize about this data, you should put it in a text format just below that table. And you can say, as in table number so-and-so, this is the summary. Similarly, if we look at histograms, this is a histogram which shows variations in the HFNC parameters. So here also they have given a title, they have given a figure 2a. Figure 1 is probably already over, obviously, and it gives you about A, B, C, D, and the description or the interpretation of these figures is written in a text format just above or below the histogram. So this is another study which was in International Journal of Emergency Medicine, which showed patterns of care at adult emergency department. Here they probably looked at huge numbers. So here they used what are called pie charts. So pie charts are where the numbers are very big. So each color is represented by two numbers. So first being the number, actual number of patients seen for that particular things, as in the stroke is 139, which represents 30% of the entire data. So you have the number, that is the count, followed by the percentage as compared to the total sample size, which is 463. Similarly for the orange zone. So when it is presented in this format, you kind of get an idea which is the most prevalent, which is the least prevalent. So it gives you, it's a descriptive analysis form. It's just giving you data as it is, but it's giving it to you in a very nice way for you to interpret. So the results basically contains the data as it was collected. Present the data in an academic and unbiased manner. Do not analyze or interpret the data. You should include any negative findings. If you say, I'll give only positive findings and do not give the negative findings, it will bring down your credibility as a researcher or a scholar. If you have done any statistical significance, include it, but don't really analyze it or interpret it. Just include it as a part of the results. It's also important to review your data. Suppose yours is a one-year-old study, meaning the study is being held for a period of 1 year. Then it's important to review your data every 3 months, just to know where you stand and whether you are in the time frame and whether you have collected all the data. If you try to finish it at the end of 1 year just for the purpose of completion and make it a last minute thing, then it's going to be very difficult for you to collect something which has happened more than 6 months or more than 8 months back, because the people who are dealing with the patient might have left the department, or you may not get the papers, or you may not get the documentation, parameters, a lot of things may happen. So it's always better to have periodic review of data with your guides or supervisors so that you know where you stand and you are in line with your thesis. So you can have a checklist for that, or you can set a time frame with deadlines. And whenever you're collecting data or reviewing data periodically, don't analyze it. Just see where you stand and whether you've collected all that you need, so that bias is avoided. And it also tends to alter your course. You tend to get deviated and you tend to get new ideas and you'd like to change something. So always avoid interim analysis when you're reviewing your data. Next, we come to the discussion. A discussion is always targeted. It is the analytical part of the study. Keep it focused and avoid plagiarism. So what is plagiarism? Plagiarism is theft of other people's words or ideas. Basically copy-paste, which a lot of people do. If you're claiming or trying to claim other people's work as your own without giving them due credit. So this can be intentional or deliberate or unintentional. Always try to write the discussion in your own words. Avoid copying and pasting. Use your own things. If you are adapting anything from anywhere else, provide a hyperlink or a superscript to the same, and you give due credit to the person whose idea it was in the first place. So when you are writing the discussion in your own words, you should use the first person or an active voice to make it lively and interesting. Even if you're a single author, you should use we. We found that the results were so and so. We analyzed the results to be so and so. Even though you're a single person, it's always better to write it as we. Always use past tense when you're referring to your findings, and use present tense when you're using general information or true information or facts. Also use a present tense when you're answering a question or stating your study's significance. So there is a structured format for discussion which has been published by Doherty and Smith in 1999, which involves 5 components of writing a discussion. Let's go through each one one by one. So the first would be a statement of the principal findings. So you start with a sentence that shows that you have found something new in your study. Preferably, you can even make it a short paragraph, but keep it concise. So you can either state the key findings in your results, or you can begin with the general information which was given already in the introduction section. The second would be to delineate the strengths and weaknesses of your study. So it's important to do both. You should give equal importance to highlight both your strength and your limitations of the study. Okay, so why do we need to know the strength? Because it validates your study findings. But often readers are interested in weaknesses because they can probably do another study looking at your weakness. And also you need to give reasons for the limitations found and implications of these limitations for the conclusions of your study. If you can also propose modifications and improvements in the study design to help other readers in making mistakes in the future studies. So example, so if I were to write about the strength of the study, I would say that this study has several strengths and highlight them as 1, 2, 3, 4, 5. Or I would say there's an important caveat for interpreting our study and write out the limitation. Or say there's an inherent weakness, or there is another important limitation of the study. You can also have confounding variables which interfere with the results, and you can say how you try to control them. So you say we try to control for the confounding variable and this is what we found. So, or you can include both the strength and weaknesses in one paragraph, saying that this study has some strength and this study has some weaknesses and this is what it is. The other would be the strength and weaknesses in relation to other studies. So this is the most important part of the discussion, where you are comparing your study with other studies. So you have to critically evaluate, you have to make subheadings and have a smooth flow in presentation. Now, the tendency is to avoid study with similar results. Don't do that. If you have other studies with similar results, group all of them together in a common subheading and write all of them together saying our study had similar results as 1, 2, 3, 4, 5 and this is probably because, and give whatever your reason is for that. Compare your material and method section also with that of other studies and see how similar or different it has been. If you find differences in results between other studies, you have to give possible reasons for them. If you don't have any reasons, you say that this is what you found, but you're not sure why it is, but this is what you found. For example, your study may confirm. So you can write our study confirms, or our studies are consistent with the findings of some other study. Or you can say our study differs from other studies, or you can write out what your study found and say, however, other studies found that, and write whatever was the state of knowledge. Your study can also extend information into other studies, saying our study extends or our study adds to the results of other study. Or it can also modify the knowledge of a study in a given area. You should also consider how the results of other studies may be combined with the results of your study to better comprehend problem being investigated. Or you may propose a new model. You should think of having a figure to clarify the model and describe ways to validate that model. The other thing is the meaning of the study. So you can give possible mechanisms, you can give implications for clinicians and policymakers. You can also emphasize what the results mean, but it's also important to emphasize what they do not mean. At the end of the discussion, you should talk about new research new research to questions that are unanswered by your study, so that this is what the reader is benefited from. Why would somebody want to read your study? One is to see whether they can use it in their work area, and second, to see if there is something they can do from there. Could they take it as a base and move ahead from there? So this is the most important part. So unanswered questions and future research should also be addressed to in your study. Now there's a lot of confusion between results and discussion, hence I thought I'll just put this up. So results is only your data. You're not making any claims, you're not giving any opinions, you're going to have neutral wording, and it forms a base. So you're going to discuss based on the results presented. And the discussion contains your strengths, your claims, your weaknesses, analysis and interpretations which were found, new findings, and comparison with other studies. Coming to the conclusion. The conclusion should be a summary of the result of the objectives. It has to be specific. If there are any new findings which have been found in the study, that should also be mentioned in the conclusion. And always end with a call to action or a request for support in the conclusion. So when a thesis is being submitted, it will have the topic or the title, introduction, review of literature with the objectives and the research question, the methodology, the results, the analysis of the results, the discussion, conclusion, and references. Apart from this, it's important to have declaration. Declaration by the author, by the co-authors, and the guides, saying that it's a piece of original research, and if it has been adapted, you're going to say where it has been adapted from. You would like to acknowledge other people who helped you come with data collection, analysis, etc. The ethical and the scientific committee approval letters. It should contain the study pro forma, the patient information form or the consent form pro forma, and if it's possible, if asked for, you should be able to provide the forms collected for each patient. Disclosures and conflicts of interest, and it should also contain the master chart. There are some tools which are available online for thesis writing. Mendeley is a very, very good tool. It's an app which you can download. It helps you sort out your references. It helps you writing your introduction, literature review, and discussion. And it's very good for referencing and citation. Plagiarism checker, you might be required if you're thinking of publishing the document later on. You might be required to submit a plagiarism check document as well. And Microsoft Word is what is widely used by all PGs usually for writing out the thesis. So there is the Indian ICMR School of Public Health, which has got this basic course in biomedical research. It's an online course for medical postgraduate and teachers in India. You can just Google ICMR basic course in biomedical research, and this is a free self-paced course which covers all the modules required to go about any research topic or research question. It teaches you all about biostatistics, how to write the study, how to go about with the methodology of a study. It is module based, and there are some questions. Like there's a test at the end of it, and once you finish it, you get a certification as well. So it's quite a nice course. So I strongly recommend that anybody who's going around for a thesis do the BCBR course, and do it so that you answer the test as well, not only for the purpose of doing your thesis, so that you understand how to go about research methodology. The equivalent to this is a Good Clinical Practice Certification Program, which is an international program, which is now brought about by many institutions. This is not free, this is paid, but it's also equivalent. The BCBR is good enough. So this is another certification program which can be considered. So I would like to conclude saying work smart and not hard, and definitely not hardly. There are a lot of tools available online. There are a lot of ways you can go about it. So if you decide your topic and decide your methodology properly, it's not going to be difficult at all. Involve peers and guides, because any research program is a team effort. You cannot stand alone and do it. And it's very, very important to be updated regularly and be monitored so that you finish it in time and just not leave it lagging. Don't worry about the results. Don't worry whether the results are in favor of your topic or against the topic. You can provide a justification around most of the things anyway. Nobody is going to fault you or say that, oh, you didn't find the results or the results didn't suit the title. It's about doing the research and presenting it and organizing it. It's not about hitting the dart to the goal. So these are my references. Thank you, and I'll be happy to take any questions if there are.